Most nursing students panic when they see multiple abnormal labs on the NCLEX. Today, we are going to walk through a single patient lab from heart failure, kidney injury, electrolyte problem, and the lung issue. I will show you exactly how to prioritize like a nurse when it comes to the NCLEX when you see lab values, whether in the nursing school or taking the NCLEX, RN, and LPN. This is Adapt NCLEX. Stay with me. Our patient is a 60-year-old male, shortness of breath with confusion and a decreased urine output. His past medical history, he has CHF, diabetes, and chronic kidney disease. What do you think is going on with this patient? Shortness of breath, confusion, and a decreased urine output with this information about his past medical history. I'll give you his vitals. This is his vitals. His temperature is 100. Blood pressure 92/58. Heart rate 118. Respiratory of 26 and saturation 89. What pop out to you right now? Look at his vitals. You can see that his blood pressure is low. Something is wrong. His heart rate is fast. What do you think? And he's breathing really fast. And his lung saturation is poor. These are what the things NCLEX or nursing school want you to interpret it. I can tell you already, we have a clue about fluid overloaded. Which of these tell you about fluid overloaded? And a possible what? Heart compromise. What do you think? On assessment, we have crackles, class 2 edema, and confusion. Look at all these things. What is contributing to the client situation? This is the way you should interpret lab values when you see patient information. And I'm going to show you. This is what you see on assessment. Classic signs of what? Heart failure you can see is going on with this patient right now. And a possible electrolyte abnormality based on their condition, based on his heart rate, based on the rest of the vitals and past medical history. You know there's electrolyte problem, there's fluid abnormality. All of this should be triggering in your ear. Now, this is the lab value. We have sodium, potassium, calcium, and magnesium. I've given you normal values. When the NCLEX give you this, they don't want you to bother too much. How do you interpret it? Most students worry about lab values. They're very disturbed when they see them. They don't know how to put it together. You can see, I put them in red, all of them abnormal. But which one do you prioritize? How do you take this information and connect it to the patient that is going on? What do you see? You can see there's what? Hyponatremia, right there, sodium 128. Hyponatremia. You can see there's hyperkalemia, potassium 5.9. What else do you see? You can see calcium is too low. And then magnesium is also too low. So all the client's lab values are abnormal. Classic, right? And therefore, this is the question. Which of this is most dangerous right now? We have hyponatremia, hyperkalemia, hypocalcemia, hypomagnesemia. Which of this is most dangerous right now to the patient? If you say potassium, you are correct. If you say potassium, you are 100% correct, because the priority right now is what? Because priority right now is what? Hyperkalemia. And this is the most important thing you should worry. I know about sodium being low. I know about potassium being high, calcium being low, magnesium being low. But most one that you should prioritize right now is what? Potassium, because it can cause what? Fatal dysarrhythmia. We're trying to understand lab values. When you see them, you can understand them and you can use them to answer questions. So that's the priority right there. Now, if I tell you the BUN is 42, what do you know about it? Creatinine 2.6. What do you know about it? I can tell you creatinine is abnormal. BUN is abnormal, right? The normal value of creatinine is like 0.5 to like 1.2 to depending on the condition. And the BUN is 10 to 20. And so when this level goes up, when you have low fluid content in terms of your kidney function is not working, all the normals goes up. The BUN goes up and the creatinine goes up. Your normal BUN and creatinine ratio, so BUN over your creatinine is usually 20 to 1. That's why your normal creatinine baseline is 1 and BUN 20. If it changes, the ratio changes, then you have a problem. BUN of 20, BUN of 42, and creatinine of 2.6 is abnormal. The other thing they will give it to you is GFR. Most students get confused about glomerular filtration rate. Pay attention. I want you to stop the video. Write this down. When you see this lab information, don't freak out. When you have chronic kidney disease or acute renal failure, your creatinine and your BUN, both of them goes up. But your GFR decreases. So a good kidney that is working, GFR is good, and the creatinine and BUN are normal. A low GFR means your kidney is not working. So patients with the renal failure who have high BUN, who have high creatinine, and the GFR, glomerular filtration rate, will decrease. Don't forget about this key concept and don't let the NCLEX try to trap you on nursing school. Therefore, the BUN is high, the creatinine is high. These are indicating what? Acute kidney injury. This is why the patient potassium is high. And this is why the urine output is low. You see how you can connect them. Patient urine output is low and the potassium is high because there is what? Acute kidney injury. You see how you can put the case together. Now, the troponin is positive. What does it tell you? And the BNP is also high. This is giving you a clue that there's a cardiac issue going on and you got to figure it out. So a troponin that is positive means what? Patient may have an MI. So the presence of a positive troponin is what? Heart attack. You have to interpret the lab values, not just look at them. A BUN means we have fluid overloaded. So there's worsening of what? CHF. The patient's CHF is worsening because they're retaining fluid and because of what? The kidney is not working. The NCLEX always makes labs, give you these labs like this so that you can get confused. They want you to prioritize. We have a positive troponin, and we have a BNP that is elevated. All this is telling you that there is something life-threatening, but you got to pick which one you want to pick, which one is dangerous, and which one you should focus on. Now, this is the ABG. pH is what? Low. CO2 is elevated. Bicarb is almost trying to compensate. If you need more content on how to interpret ABG, check out that NCLEX. But this is telling you that there's form of changes to the patient lung function or kidney function, and this is being affected. So the ABG, what kind of acid-base imbalance do you see? A low pH, a high CO2, and an almost close to normal bicarbonate. What do you think? The pH is low, therefore it has to be acidosis. Why? It's less than 7.4. If you have your own strategy how to interpret it, that's fine, but this is less than 7.4. I know it's acidosis. What is creating the acidosis is not bicarbonate. If it's bicarbonate, it would decrease. It's normal, and therefore the CO2 is the one causing the acidosis. Therefore, this is respiratory acidosis. Why, how, and what is causing this respiratory acidosis? Is because the lung is retaining fluid and is retaining CO2 because of the pulmonary edema from what? Crackles in the patient lung. The patient has fluid overloaded, putting things together. Therefore, remember, if your lung does not function, your CO2 goes up. If your kidney does not function, what is going to happen? The bicarbonates will try to go up. Therefore, pay attention. Now, This is the patient CVC. Y count is 14. That means it's elevated. It's higher than normal. The hemoglobin is low. The platelet is also slightly low. What would you interpret from this? There's a possibility of infection. That's why the Y count is elevated. So there's infection there. The patient may have anemia. That's why this is low. And there's a risk of some bleeding. Low risk per platelet is 120,000 is okay. Put it together. But these are not priority. Elevated white count, low hemoglobin, and platelet is still not a priority. All of them go back to the potassium. Potassium is the most dangerous one in this patient. Now, let's see what we can do. Which finding require immediate worsening? Which finding require immediate nursing intervention now? We already talked about it. I just put it in the question form so that you can see the sodium is low, the BMP is elevated, the potassium is high, hemoglobin is also low. But when they come to lab value prioritization, which one is life-threatening? Is the potassium. So number 3 is the right answer. This is how you interpret the whole case, and you can figure out what is going on with this patient. Which conditions does the nurse suspect? This is where I want you to take the lab values and then use it to answer the question. Why would the patient have acute kidney injury? Why would the patient have what? Heart failure exacerbation? Why would the patient have DKA? Why would the patient have respiratory acidosis? Why would the patient have what? Hypokalemia. Is this all related in the case? Do you see that? Do you see that this is part of the case that we saw? What do you think? Of course, we saw the BUN and the creatinine elevated, therefore acute kidney injury. We saw BMP is elevated, heart failure exacerbation. There was no evidence of DKA. We saw the ABG shows respiratory acidosis, and then calcium is low. These are all the conditions the patient is suffering from. Which action should the nurse anticipate now? What do you think? Potassium is high. What do we do? Cardiac monitoring. Do we give them next dose of potassium? No, we hold it. Do we have to give them IV calcium gluconate for what? Yes, in order to protect the heart, stabilize the heart. Do we let them drink? No, they are in the bad situation. Do we prepare for diuretic? Yeah, to get rid of the potassium. Therefore, 1, 2, 3, and 5. In addition to the fluid, this diuretic will help with that. This is what I want you to take home. All the things I've talked about. This is the only page I want you to pay attention to. Look at the lab work and then interpret it. And then you can use it to answer the question. Respiratory acidosis, where did it come from? CO2 retention, because the patient has a lung issue. Hyperkalemia, why? Because potassium is 5.9. What should you worry about? It's arrhythmia. Sodium is low, 128. What should I be worried about? Confusion and seizures. You see all these things. Every time you see the lab work, one word should come to your mind. Acute kidney injury, because BUN and creatinine is elevated. Heart failure exacerbation, because BMP is there, and the crack was edema. If I put it together, this is what the patient will have. Patient may have possible MI because troponin is elevated. It may have infection because of what? The VVC. This is what NCLEX want you to know, not to memorize the numbers and you don't know how to use them. Look at a situation. They will give you a case. They'll give you a bunch of lab value. Interpret the lab value to the patient condition and make sure it matches. Thank you for watching. And if this short video helped you, subscribe, adapt NCLEX for more content like that, and check the website for more videos on how to interpret lab work and how to use them for your NCLEX. Take care of yourself and good luck.